Okay, that was definitely very emotional, inspirational, and enlightening. Thank you, ladies, once again. Also, the teenagers are so funny. Gen Z is hilarious. You guys are my favorite generation at the moment, actually. Okay, so actually, our next panel is also one of my favorite panels because it's something I'm very passionate about, diversity, equity, and inclusion. So to moderate this panel, I'm calling upon my friend and colleague, Ka-Ho Wong, who's actually here from Salt Lake City. He is a researcher at the University of Utah Health and works with Dr. Stacy Clardy, Mitzi, Doug. You guys know Stacy, Grace. Come on up, Ka-Ho. He'll be moderating this session. And joining him will be panelists Dr. Madeleine Hebert, Dr. Mitzi Joy Williams, Avery, and Jayla. Come on up.
Well, first of all, thank you, Sumara, for inviting me to be a moderator, and thank you, everyone, for joining us. So without further ado, I'm going to have each one of our panelist member to introduce themselves. Avery, do you want to start for us?
Hi again. I'm still Avery Allmond. I was diagnosed in.
Are you sure?
I think so. I was diagnosed in 2017 at the age of 19.
Hi, everyone. My name is Maddie. I'm Dr. Hebert. That's how you pronounce it. It's hard. And I'm actually the first pediatric neuroimmunology fellow here at CHOA and Emory, just starting my fellowship year this year. And I just graduated like 3 weeks ago from child neurology residency. Thanks. So I'm really excited to start my fellowship. And thank you so much for having me.
Hi, I'm Jayla again. I got diagnosed in 2020. I was around 13, I think. Yeah.
Hey everybody, Mitzi Williams. I'm a neurologist and I do a lot of work focused on diversity in clinical trials as well as increasing health equity in the neuroimmunology space. So happy to be back again for my second time.
Well, thank you, everyone. So I wanted to kind of start off talking. Oh, should I? Okay. Well, my name is Ka-Ho Wong. I am, like what Sumara just said, I'm from Salt Lake City, Utah, or I live in Salt Lake City, Utah. So currently I'm actually doing a PhD in population health science, focusing on health equity and diversity in NMOSD and MOGAD, looking and see if that interact or have any correlations with clinical outcomes as well too. So thanks to Sumara and the TSF, they were able to fund my dissertation as well too. So thank you very much, and I'm honored to be here as well too today. But I don't want to take the time away from all these great panelists, but I wanted to kind of start off with Avery, if that's okay with you. Kind of, if you could talk to us, do you think there's any challenges or any issues you're running into, that you feel like it's related to health equity that resulted to, some diagnostic delay or any treatment options delay that you feel like you were experiencing or you experienced before?
I feel like one of the biggest things is lack of resources. I think in especially diverse communities, it's harder to get information sometimes that is pertaining to your rare disease. And especially being a person of color, there's different barriers and challenges and unconscious bias that we have to kind of deal with. So I think the biggest thing is lack of resources and lack of representation, giving those resources as well.
Right. Sorry. And then Dr. Hebert, what do you see a lot that you feel like that are some resource challenges and that we could improve in the healthcare field as well too?
Yeah, so this is something I'm really passionate about, healthcare access and equity. I think from my residency experience, I definitely noted that there was a lot of unconscious bias in the healthcare system in the U.S., and there's a lot of differences in people's social barriers to getting healthcare. And then I also did a project actually when I was in residency where I went to Ethiopia for a month just to learn about healthcare access there and how different it is. And it was very eye-opening because there's a lot that it's just different from in different countries, and so it really opened my eyes. So that's why I really want this. A lot of my fellowship projects this year are going to focus on healthcare access and how it's changed for our population. So a lot of studying how having a healthcare coordinator like Gwen has helped our patient population and how important it is to have resources like her. And then, so that's a lot of what I want to study in my fellowship year.
Great. And Julia, can I ask you, what are something that you feel like we could improve in the healthcare field to kind of, bridge that health equity gap that we're seeing, or health disparity gap that we're seeing?
From my point of view, I haven't seen like really any big problems because like I really just don't know. I haven't really seen any really big problems though, like any with the doctors or like with Gwen or with Dr. Gombolay, other than like my health insurance. Like they declined a lot of my my medicines to even get like nurses to come to my house or anything to get my infusions there. That was the only like big problem that I've really seen.
Yeah, no, I agree. And I mean, I think insurance has been an issue, not just for, all of us here, but I mean, it's really, quite frankly, it's for all the patients who use this U.S. healthcare system. So that is a great point that you touch on. Mitzi, I have read a lot of your papers, so I'm fanboying right now, right here. So I would love to hear about your thoughts on what could we do, in our healthcare field. What could we do to really bridge that disparity gap as well, too?
Well, I think it certainly starts with education, right? And I think it starts with education of our primary care workforce, right? So when we think about diseases like NMOSD, MOGAD, neuroinflammatory diseases, people often go see someone besides the neurologist first. So they may go to their primary care, right? If symptoms are really severe, right, like someone goes blind in an eye, they will probably get diagnosed more quickly. Where I have more trouble is where someone may have subtle symptoms, right? Like a leg is numb or they're weak, right? And then we go see the primary care. They say it's a pinched nerve. You go to PT, it doesn't get better. I've had people that have had surgeries for a degenerative disease, right? And it's not gotten better. And so I think it really starts with educating our primary care workforce to understand that they need to be looking for these things, even though they're rare, right? These are the things you don't want to miss, right? That can really make someone disabled. And I think the other piece is raising awareness amongst the community. So for many diverse communities, I'm a member of the Black community. We know about high blood pressure. We know about sugar diabetes or whatever you call it. We know about certain diseases, but we don't know about neuroinflammatory diseases, right? We don't talk about MS. We don't talk about NMOSD. And again, although they are rare, we do have a lot of data suggesting that these populations are disproportionately affected by these diseases. And so we have to make sure that our primary care physicians are aware, but also the community is aware, that, hey, if your leg is numb and dragging, that's not normal. Go to the doctor, right? You don't sleep it off, right? Go to the doctor and get checked out so that you can make sure that we're getting ahead of this thing.
Right. I mean, 100% agree. So I know that earlier when you're introducing yourself to is you're just kind of a follow-up question. You said you do a lot of disparity research on how to get our underserved community into clinical research as well too. So what are some of the movement or advice that you could give our folks over here today?
Yeah, so this is, a huge issue, not just isolated to the neurology space. It's something that we see in every disease state. So whether it is cardiovascular disease, all diseases, we really have trouble with diversity in clinical trials. And particularly for our neuroinflammatory diseases, most of our studies are conducted primarily in Eastern Europe, right? And so although, we have great research that has come out of those studies, when we come to our population, which my population and many of my patients are African American, and I try to say, well, what data is there in our studies about you? Like, it doesn't exist, right? Or there may be 5 people in the clinical trial or 10 people, and you can't make a generalization out of that small number of people. So generally what I talk to people about is, that research in some form can be for everyone, right? So whether it is a clinical trial, we need people in clinical trials. If that's something you're interested in, talking to your physician, particularly if you're with Dr. Gombolay at, a academic center where they're running research trials, kind of, try to understand what's going on. But if that's not for you, how about a survey, right? How about a registry, right? every little bit of information matters, because it helps us to better treat everyone when we understand this disease process in a variety of people, and particularly when we talk about certain populations where we say the disease may be a little bit more severe, right? So not everyone who is Black has horrible MOGAD or NMOSD, but there are some people who do have more severe disease. So when we capture everybody, when everybody's voice is counted, that's when we really begin to get answers that will benefit everyone with these conditions.
Right. No, I agree 100%. And I actually wanted to kind of hear from July and Avery from your perspective. Would you sort of join clinical research, or would you have any questions from our end? Because we have two experts right here, and I would love to hear your thoughts on that as well too.
I think it kind of depends on who the information is coming from. I know trust in the medical system is big, especially if you're a diverse patient. So I think I would be more willing to join a clinical trial if I see that there is a biracial person of color or a person of color that is giving me that information, because I feel like at that point that's instilling trust in what's going on in the clinical trial, what's happening, and I can be for sure that none of my information used in the clinical trial is going to be used for the wrong reasons.
Right. And July?
I believe I'm in one already.
Oh, amazing.
Yeah. I'm I think I'm in one with Dr. Gombolay, and they're doing research, and they just take a little extra blood at my checkup appointments.
That's great. That's great. So I would like to ask Dr. Is it Dr. Hebe? Hebert? Okay. Sorry. Dr. Hebert, what do you think it's the next step to get more of our to kind of move everything forward as well too?
Like in the research.
In the research space. And well, quite frankly, in the medicine space as well too.
Yeah. So I think like Dr. Williams had spoken about, making sure that people are aware of how they can get involved in research, like registries and surveys or anything like that. I think the next direction is obviously just getting more diverse patients represented in the literature. I think that's like key to finding new treatments.
Yeah, so this is a very complex problem that takes many, many people to help fix, right? I think we have to think about it from a couple of different perspectives. So certainly, clinical research is conducted and trials are created by certain entities and companies, right? So we have to look at the way that we create our research to make sure that we're not automatically excluding certain groups of people, right? So we know some groups have a higher incidence of, what we call comorbid diseases like hypertension, diabetes, right? And so if to get in this trial, you have to be like this perfect picture of health and not have any problems, it's going to automatically exclude large groups of people who have these problems. And so we have to look at the way that we create our trials, right, to make sure we're not excluding people. We also have to look at where we're conducting research. Are we going to places where there are diverse populations of people, right? Are we looking at some of our community neurologists or neuroscientists who want to engage in clinical trials? Are we broadening that? Are we partnering with other people? Are we getting information out about where people can get involved in research? And then I think, from a provider perspective, we have to be intentional, right? We have to be intentional and look at every person as a potential person that can be involved. We can't look at somebody and say, well, the last person that looked like this told me no, so I'm just not going to ask. And I think sometimes people get discouraged and do that. So we have to look at it from multiple kind of areas and lenses to really try to get to the bottom and start solving this issue.
Great. Well, I wanted to sort of switch to gear a little bit. I see my colleagues from UCB, my colleagues from Amgen. I think I see some of my colleagues from Alexion as well, too. But I wanted to ask all four of our panelists, what are your thoughts that these company could do to help you as well, too? What are some things that they could provide in terms of supports or in terms of, barriers that they could overcome? Maybe, what could they do to help? To advance, and achieving and then overcome some of the challenges that you're seeing right now?
I think the first thing, which I think the pharma companies do a great job at, is just starting with a conversation. Even if it's coming from a person that's not diverse, just having that space and allowing people that are of diverse backgrounds to be able to talk about the things and the barriers that we specifically go through, I think is a great start. And all of the pharma companies do a great job at making sure that we know that our voices are heard and that they're actually listening to us.
Right?
Yeah, I think a big thing that the pharmaceutical companies can ask about, like, is actually talking to the patients about what's a barrier, like why not this medicine? Is it about access? Is it about the infusion center is too far? Is it about cost? Is it about your prior auth problems? Like actually figuring out the problem to why that medicine might not work for them, and then they can troubleshoot the issue. So I think it's actually talking to the patients, the people who have to experience getting the medicine, like what are the barriers, and then also what are their concerns about the medicine, like when they talk to their provider and they went through all the side effects, like what concern them, because some side effects might stand out or scare people more than others. So it's a lot about communication.
This is where I look to my mom to answer the question, but I like I said, I really don't know because I don't see a lot. I just I just pay attention and focus on like the things that bother me the most. But like I communicate very well with my doctors, and I do see certain, like when I say certain things, they do a lot of other things to help with that.
Yeah.
Well, I could say a lot, but we only have 14 minutes and 13 seconds. So I would say, put your money where your mouth is. Invest in the community, right? Particularly if we're talking about achieving health equity and increasing diversity in clinical trials. You can't just walk into a place and say, come be in my trial, right? Without some type of investment, people knowing that you care about that community. So partnering with organizations like the Meyer Foundation, like We Are Ill, and other organizations in the neuroimmunology space is really important. And then the other thing that I would say is that when we're talking about specifically clinical trial improvement and diversity, you have to be intentional, right? I started doing this a long time ago. And when I started doing this work and I went to look for trials about, Black people who were the people I was treating with these diseases, there's no research. And today we're doing a lot better, but, we still got a long way to go, right? So for NMOSD, which is a disease that we know disproportionately affects people who are of African descent and Asian ancestry, our clinical trials are still primarily with European people, right? With very low numbers of people that are most affected. So there's something, we still got some work to do, right? So we're still not quite getting it right. And I think that in order for that to move forward, we have to be very intentional about making sure that we're including people in this research so that we can make sure we're getting the best treatment for everyone.
I agree 100% from everyone, and you're welcome, Farmer Partners.
Free ad board, see?
Free ad boards, there you go.
Free ad board.
So I wanted to keep a lot of the time to open to our audience, but I do wanted to ask one last question: is as a patient, as a provider, when a new patient comes in and when a new provider who comes in, what are some of the resources or what are some of the advice that you could give them? Hey, this is something you could do to overcome some of the challenges that I've gone through already.
I'll pass it to you. I'm going to think about that.
Okay, I'll go first. I always got something to say. I think the thing that I really encourage people to do is to advocate for themselves and educate themselves, right? One of my goals is to make sure that my patients understand their condition to the best of their ability, understand what the treatment is to the best of your ability, right? I don't expect you to go to med school. Some of y'all go to Google's med school before y'all come and see us. But I don't expect you to go to med school, but I want you to understand what we're trying to accomplish, right? And so that way, when you go see the next doctor, when you go see the next person who may not have ever heard of NMOSD or MOGAD, you at least have some basic understanding. And then also to have the courage to say, you know what? I don't feel like my concerns are getting heard. I don't feel like, this is working for me. Let me go somewhere else, right? The ability to be able to say, this is not working. Let me find the care that's appropriate for me. And so that's what I encourage all of my patients to do when they're first diagnosed. And of course, to focus on brain healthy behaviors, things that they can do to help themselves.
Great.
For for me, for a new provider, I would say to listen to your patients and to actually take notes on like what they're talking about and what they're saying. Like even though it might not make sense, but like that's the stuff that we're experiencing. Like it's crazy. Like it's out of this world. Like it would, like explaining myself. Like I wouldn't even think like I would go through something like this. Like if I was to look back before I got diagnosed. So and like I'm sorry, like just listening and using terms that are understandable because it's already confusing as it is to talk about it. So when you come in, I know when I first got diagnosed and I was like, it was like a whole bunch of doctors in the room. And like this one man, he was just talking and he was saying like so many words that I did not understand. And then this one doctor stepped up and was like, okay, so this is this. And then I was like, okay, that's more understandable. So yeah, just listening and being understandable for the patient.
Yeah, so I'll piggyback a little bit off what both of Dr. Williams and Jayla have mentioned. I think advocacy and then creating a space for advocacy for that providers have to do is so important. Everyone's been through different doctor experiences and doctor appointments where, like, maybe the doctor wasn't paying attention to you, they were on a computer the whole time, or there's just different spaces where you just didn't feel like you actually had the opportunity to advocate for yourself because maybe it was a short visit or something like that. I've experienced that as a patient, not with neuroinflammatory disease, but I think we all have in the healthcare system. And I think on both sides, you have to. It's unfortunate, but a lot of patients and their families have to learn the right way to make an opening to advocate for themselves, and it's such a skill that all doctors need to work on to actually give the space for them to do that. Like maybe don't look at your computer the whole time. Actually, give space to listen. So those are the biggest challenges that I think doctors need to work on in building trust.
And kind of going off of that is don't be afraid to speak your mind when it comes to doctors. I think a lot of us get intimidated because you see somebody with all these degrees and they're supposed to know more. Well, sometimes it's okay to have degrees and still be able to learn something, especially if it's coming from patients that have actually experienced it. And kind of going off of what Jayla said is a lot of these doctors don't have the best bedside manner. And I think it's the way that they say things to us. For instance, I had a doctor, I was just learning to walk again, and my doctor was jokingly like, so are you running yet? It's just conversations and the way we talk to patients, I think we could do better. But advocating for yourself and being able to say, you know what, I didn't really appreciate that comment. I don't really feel heard by you. I think that's a good way for patients to make sure that they're heard and they're advocating for themselves.
Great. Well, I would like to open now for the remaining 8 minutes and 3 seconds to the public. So please, anybody?
This question is for Jayla. Since we started, yeah, and going to campuses, I'm always advocating for you. I have questions too. How much more do you think you've learned about this disease that you have?
So at the camp that you're referring to, it was like an NMO and MS camp. So basically, it was like a lot of like other kids that go through what I went through, and like just talking to them and like hearing their experience and stuff was very like, I wouldn't say pleasing, but it was very like it felt like a comfortable space because like I was like, so I'm not the only one going through this. And I actually met a girl. She was like, she almost had the exact same symptoms as me. It was like a couple of things that were like a little different, but I was like, it was like so like welcoming and like it got to like it was so happy like to the point like where it almost felt like overwhelming. So like one day like during the camp like I just had to sit down like and just stay in the cabin the whole day because I was like it is like a lot going on, and especially for me like being new and that was like my first time meeting other people, so it was very like it was a lot on my heart, but it was a very nice experience at the same time.
How important do you think mental health is to get mental health when you first diagnosed or at any point in your
I
time?
think it's very important to like I said, just be self-aware. So like if you know you feel like you need to talk to somebody or if you need any type of like mental health, like get that. Like don't be afraid to speak up, to advocate for yourself because that is very important.
I think equity or inequity also extends to peds. There aren't enough pediatric patients in trials. So I guess Mitzi and Dr. Hebert Did I say it right? Okay. What can we do? What more can we do to include children and teenagers in these trials? Because it's in the example of NMOSD, it's great we have 4 FDA approved therapies, but people under the age of 18 can't access it. So they're still being put on some of the older therapies that may not work as much. So like, do you consider peds to be a part of these groups that are also experiencing inequity?
Absolutely. So when we think about underserved populations, oftentimes the first thing that comes to mind is people of ethnic minority groups, but there are many, many underserved populations, particularly our pediatric population. And then in the field of neuroimmunology, our let me be very judicious in the word that I use, older population. So for the purpose of trials, over the age of 55 is considered older, although let me be clear, 55 is not old. I'm closer to 55 than I am to 25. But for the purpose of our trials, we don't have a lot of information about what happens over 55. And so, we have our rural populations, those who don't have access. We have our LGBTQ plus populations. And so there are many, many groups that are excluded from this process that we need to learn more about. One way to start is with pediatric demyelinating centers like the one here, where you have dedicated neuroimmunologists who are conducting research, right? But we need to find out ways to kind of fold these populations into the broader clinical trial population as well.
Yeah, so this is one of our biggest problems in pediatrics, in not just neuroimmunology, but in all kinds of fields. You can't do clinical trials, so it's a lot of it just relies on adult clinical trial data and then retrospective, just like case series and then also anecdotal, like from big centers. So having a big center like this, where we actually have more patients, like bigger patient volumes of patients with these rare diseases, is crucial for actually getting experience with treating these diseases. So we use everything off label, basically. And so that is definitely a big piece to there being disparities in care.
A question related to that. So I think the older patients in the room that were diagnosed before the new therapies were available, they know this. Even getting on rituximab was difficult. And once the new therapies were available, all of a sudden the insurance companies were requiring folks to step through the older therapies before getting on the new therapies. And I think this shows up particularly for communities that face a lot of health inequities. So either underinsured, uninsured, poorly insured. We know there's a lot of garbage insurance out there, depending on the state you're in. So to everyone here, either the patients or the doctors, how do you see this challenge of access to therapies, prior authorization requirements, et cetera? And what, if anything, could be done to kind of change that so that people actually get the therapies that are proven to work for these conditions?
I'll start. Yeah, that's a tall order, right? And something that we deal with, particularly in this disease, and particularly when we think about the fact that there is a lot of data suggesting that if we put people on really good, effective medicine early, they do better than if we just kind of meander around with this one over here and this one over here and this one over here. So I think that those are things that our advocacy organizations really can help us in going to our policymakers, right? So that Capitol Hill visit, some of our other advocacy groups working with policymakers to say, listen, we need to get people on effective medicine. I think there has been some headway. We talked about in some of our meetings, the WHO has released a list of essential medicines that's included some medicines. However, we were on a meeting the other day and a doctor in India couldn't get the Rituxan for somebody with NMO because it wasn't approved there. So, there's still a lot of work that needs to be done, but it's got to be at the policy level. So that's something where we've got to go to the lawmakers and say, you got to help us out here. Please don't make our patients suffer, right, and go through disability when we know there are things that are effective that could keep them out of trouble.
And I think it's also important that patients, we call you to the forefront to be able to share your story. We can't bring this to policymakers if we don't know what's going on. So I think it's very valid and important that if you are a diverse patient, that's not just pertaining to race, that could be gender, sexuality, whatever have you. But I think it's important that you share your story and the barriers that you face so we know how to approach lawmakers and we know what to ask for.
I'm one of those older patients. Okay, I'm sorry.
Be careful. It's not old. It's mature.
I'm one of those mature
There you go.
patients. Initially, when I got diagnosed, I wasn't as mature. It's been about 9 years, but I went through a lot to get approved for Rituxan. Great. Emory is great. And I was one of the patients who was diagnosed immediately within 2 weeks. I got on Rituxan and within about a month and a half. I sat in Emory Johns Creek while they got me approved for Rituxan. I sat in the waiting room. But now it is one of those drugs that is not one of the approved drugs, but I've been on it now for almost 9 years. So as we watch other things become approved, and then as I watch people in groups say, hey, listen, now my insurance company no longer will let me get it. I've been on it for almost 9 years. It works for me. If it becomes one of the drugs that is no longer approved with my insurance, which I've gone through several insurances over the years, then I've got to go through a process of saying, what do I do? What if the next one doesn't work? And now I'm one of the more mature people. What will I do? You know, the next one may not work.
And so that's a difficult issue, right? And it's something we go through not just with drugs that are not necessarily FDA approved with conditions, but with drugs that are FDA approved, right? So if I have a patient who's on an approved therapy and they switch insurance in October, there's no guarantee that in January I'm going to be able to get that medicine, even if they've been on it. So again, it goes back to us going to these policymakers and saying, listen, somebody's doing well on this, right? There've got to be some allowances. We used to be able to what we call grandfather in treatment. So if you were on and you were good, they had to do it. But now they don't. So, there's a lot of work that needs to be done in that regard.
Well, I think our time is up, so let's give a round of applause to our panelists.
And can I say one last thing?
Yeah,
Can I say
absolutely.
one last thing? I just really want to applaud our patient advocates for sharing their stories. It takes a lot of courage to get up here on a stage and be vulnerable and tell people about some of the hardest times in your life. And I am just so grateful that you guys are here. And I learn something every time I come to a program, and I'm just grateful for you guys sharing with us today.
Yeah.
Thank you.